I'm Dr. Kevin Park, orthopedic surgeon here at MedStar Georgetown University Hospital. I specialize in hip and knee replacements, so the majority of my patients have hip or knee arthritis in need of replacements, or even before then when we're exploring different treatment options. I really want to personalize care to each patient. Surgery is not the correct answer for every patient in terms of their disease or in terms of their lifestyle. So I try to take a kind of a whole wide approach to figure out what works best for the patient, their current situation, as well as their goals. Hip and knee replacement surgeries has come a long way. Looking into the future, newer technologies are really helping us understand the body a little bit better, as well as allowing us to perform our surgeries with more accuracy, to improve patient outcomes, as well as the longevity of the implants themselves. What drew me to work here at MedStar Georgetown was really the comprehensive care that we can provide our patients. We are able to treat even the most complex patients just because of the resources that we have. And most importantly is the team that we have here in our orthopedics department. My fantastic partners and I can really help the patients in all aspects of care to really treat them as a whole. The most rewarding part of my job is really seeing my patients return to an active lifestyle, one that they may have lost once their knees and their hips began hurting from their arthritic conditions. A joint is an area in the body where two bones meet. The joints that I treat, the hip and the knee, are really vital for mobility and function. A joint can need to be replaced for many different reasons. I would say the most common reasons that I see is osteoarthritis, or normal wear and tear of the cartilage in the joint. But there are other reasons why that cartilage might be diseased. And common things that I see in terms of that would be rheumatoid arthritis, psoriatic arthritis, or even arthritis after an injury, such as a fracture. I really try to exhaust all non-operative measures before we decide on surgery. These can include over-the-counter medications, such as NSAIDs or Tylenol, physical therapy, as well as injections that can help decrease the pain in the joint. And after we exhaust all these options, then we consider a joint replacement surgery. Joint replacements are made from a variety of materials, different from the hips and the knees. For the hips, primarily titanium is the metal that's used. There's a plastic insert and a ceramic head. For the knees, those can be, the femoral component is typically made out of cobalt and chrome. The tibial component could be either cobalt and chrome or titanium. And again, there's a plastic insert in between those two. How long a joint replacement lasts can really depend on a variety of factors. One would be how well they're put in initially, as well as patient factors such as activity level. My goal for every one of my patients is that it would last a lifetime. There are a variety of reasons why a joint replacement may fail. For the hips, we can consider instability, where the hip can dislocate. In those instances, sometimes a revision would be necessary. Infection would also be a reason why repeat surgery would need to be done. Those can be either treated with a single surgery or sometimes may require multiple surgeries. Other fairly uncommon reasons would be the implants loosening from the bone itself, or subsequent falls that can cause fractures of the bone around the implant to cause them to become loose. A typical age of a patient that I replace their joint, usually around 50 to 80 years old, mostly for osteoarthritis. But I do see a fair number of patients that are a lot younger for a variety of conditions, and so we've treated patients in their 20s and 30s with joint replacement. The younger patients typically don't have the normal wear and tear arthritis. A lot of them will have something called avascular necrosis, where the blood supply to the bone can deteriorate and cause destruction in the bone. Other instances in terms of the hip would be a hip dysplasia, where the pelvis is formed in such a way where it is more shallow, causing increased risks of or increased wear rates in the joint that may require replacement in the future. Typically, the patients that I see will complain of pain in their joints, in their hip or their knee. A lot of times people can have knee pain that is actually coming from their hip. And so whenever I see someone with knee pain, a thorough examination of their lower extremity is important to really determine where that pain is coming from. When people need a knee or hip replacement, again, first I try to exhaust all conservative measures, including anti-inflammatories and therapy. Once these fail to really provide the relief that my patients are looking for, that's when you start considering a more invasive option such as knee replacement or hip replacement. Recovery after hip and knee replacement can really vary depending on the patient. The majority of my patients will see about 80% recovery in the first 2 to 3 months. We get them all up and walking the same day after surgery. Many patients go home the same day. If not, they stay the night and go home the next day. Post-surgery, we're really focusing on recovery. So that's controlling your pain and getting you back to performing your activities of daily living. So initially we have my patients use ambulatory aids to prevent falls as they're recovering from surgery. We have extensive therapy afterwards as well to help strengthen the muscles around the joint. Once they recover, I really don't place any restrictions on my patients in terms of what activities they can do. Here at MedStar Georgetown, we really use a multidisciplinary approach to each of our patients. That involves the nursing staff while they're in the hospital, myself, physical therapy, and pain management. All these come together to really help the patient during their surgery, as well as, most importantly, after surgery during their recovery, to help speed up their recovery and allow them to regain function quickly and safely. Before surgery, really the best way to prepare is staying active to allow the muscles around the joint to remain strong. This can be done either by the patients themselves or sometimes may require physical therapy before surgery to help with that. So after surgery, the best way patients recover well is really listening to their own body. It is important to work hard with physical therapy, but it has to be done in a safe manner to prevent falls. Some patients may find themselves recovering a little bit faster than others, which is okay. As long as things are done safely, everyone recovers well. Here at MedStar Georgetown, we're fortunate enough to have the most advanced technologies in joint replacement. This includes the Mako Smart robotic system. And this allows me to use minimally invasive techniques to personalize care for each of my patients for their total or partial knee replacements. Same-day surgery is becoming more and more popular, and here at MedStar Georgetown, I really attribute that to our multidisciplinary approach, including our nursing staff before and after surgery, the therapy, as well as our pain management specialists to really tailor regimens specific to each patient. Patients should consider choosing MedStar Georgetown for their orthopedic care because of the advanced technologies that we can provide. We have a world-class team that can really provide individualized care to every patient. We can handle the most simple to the most complex cases out there.